I am McLaren. I am compassionate.
I am McLaren. I am teamwork.
I am McLaren, and I am quality.
And I am love.
And I am excellence.
I am compassionate.
Precision medicine.
Awesome care.
I am McLaren, and I am here for you.
No one word can fully describe what McLaren Healthcare is to the people who provide and receive services across this vast healthcare system. But what every person at McLaren shares is a united sense of purpose to provide the highest levels of customer service, clinical care, and treatment to people throughout Michigan. This requires an unwavering commitment to keep pace with a radically changing healthcare environment by implementing strategies that ensure high reliability, high performance, and value-based services across all McLaren subsidiaries. In 2016, McLaren accelerated its focus on systemness and further advanced standardization of clinical and business practices across the McLaren platform. Among the payoffs, a 16% improvement in our overall system quality index, numerous patient lives and millions of dollars saved through our collaborative blood management program, a 35% growth in our network of employed physicians, and the introduction of One McLaren, a new IT platform from Cerner that will standardize all electronic health records, care management systems, financial and other administrative platforms across the corporation. Being a leader in Michigan is the norm at McLaren, but one program that stands out nationally is the McLaren Stroke Network. As the only program in the country featuring interventional neurologists as first responders in answering stroke alerts, the McLaren Stroke Network is proving to save lives and greatly minimize potential for deficits among stroke patients. Utilizing telestroke technology installed at 9 McLaren emergency departments, with more sites on the horizon, the McLaren Stroke Network enables ER physicians to connect with an interventional neurologist within minutes, 24/7, to provide better diagnosis, treatment, and, if necessary, transport to a higher level facility within the network. In its first full year, the McLaren Stroke Network answered more than 1,200 stroke alerts, administered nearly 200 TPA treatments, among the top 10 in the country, and realized a 10% improvement in surgical outcomes for patients. The two hubs of the McLaren Stroke Network are McLaren Flint and McLaren Macomb. Patients who require highly specialized treatment are referred to one of these facilities for procedures such as removal of a blood clot from the brain or neurocoiling to treat an aneurysm. McLaren Flint attained the highest designation possible for stroke care in 2016 when it became one of 6 hospitals in Michigan to earn Comprehensive Stroke Center certification from the Joint Commission and American Heart Association, American Stroke Association. McLaren Flint joins an elite group of hospitals across the nation to hold this designation, after working for more than a year to achieve compliance with strict standards and requirements, including the addition of a neurointensivist to round out the team of physician experts. McLaren Macomb has also added physician specialists and new technology in the advancement of their regional focus on the neurosciences. A 3D biplane imaging system was installed in August of 2016, featuring advanced software technology that helps to detect hemorrhages, visualize brain tissue, and support accurate and quick diagnosis and treatment. Already certified as an HFAP primary stroke center, McLaren Macomb has applied for primary stroke center certification from the Joint Commission and will undergo that survey in April. High achievers are common in the McLaren system, and McLaren Northern Michigan is no exception. The Centers for Medicare and Medicaid Services awarded the hospital a 5-star rating, the highest rating possible for quality and safety. More than 4,500 hospitals nationwide were included in the analysis, which ranked hospitals from 1 to 5 stars based on 64 distinct measures. The 5-star rating places McLaren Northern Michigan among the top 2.2% of hospitals in the country. History repeated itself in a good way for McLaren Central Michigan in 2016. Once again, the hospital earned an A grade, the highest possible, for patient safety in the Leapfrog Group Hospital Safety Score report, matching a similar achievement in 2015. This rating represents a hospital's overall capacity to keep patients safe from preventable errors, injuries, and infections within the hospital. To that end, McLaren Central Michigan was also one of 3 best-performing hospitals noted by CMS for having the lowest infection rate in Michigan. While McLaren subsidiaries are continually learning from each other, they also recognize the value of collaborating with other experts for improved patient care and processes. McLaren Lapeer region has realized significant quality improvements as part of statewide collaboratives focusing on 2 key areas. The first centered on defining appropriate indications for PICC placement and decreasing complications associated with PICC insertions. The second focused on reducing pharmacological prophylaxis use in patients who are at low risk for developing blood clots. The hospital also was part of a national comprehensive unit-based safety program focused on the ICU. The resulting protocol that was implemented has decreased ICU length of stay by an average of 1.9 days per patient, decreased ventilator days per patient by nearly a day, and realized direct cost savings of $567,000. Raising the bar in clinical care is also first and foremost at McLaren Oakland. Recognizing an opportunity to enhance its cardiology service line and improve local patient access to cardiac care, McLaren Oakland invested in a $1 million renovation of its cardiac catheterization laboratory. These upgrades support the enhanced ability to perform peripheral diagnostics and interventions. The hospital also recruited a group of skilled cardiologists that serve both McLaren Macomb and Oakland hospitals, providing for a regional continuum of care for heart patients. To extend access even further, cardiology offices were opened in Clarkston and Pontiac, with one more planned for Waterford. Expansion of services was also the focal point for McLaren Bay Region, which opened a state-of-the-art medical office building in the new Uptown Bay City development. The 70,000 square foot building houses an occupational and convenient care center, as well as a wound care clinic with 2 hyperbaric oxygen chambers. Lab and X-ray services are on site, as well as an endoscopy suite and primary care. Further, the Bay Region Orthopedic Surgery Office at that location has seen significant volume increases since opening, largely due to expanded surgical capabilities with the new Mako robot at the hospital. McLaren Bay Region also recently became the first hospital in the state to offer total robotic knee replacement. As the market leader in the provision of emergency services in the Blue Water region, McLaren Port Huron elevated its status by earning state designation as a Level 3 trauma center in 2016. This classification means the hospital has 24-hour availability of specially trained healthcare providers who have expertise in the care of severely injured patients. McLaren Port Huron is the first healthcare facility in St. Clair County to earn this accreditation. The hospital is also awaiting National Trauma Center certification from the American College of Surgeons. A commitment to excellence is at the core of every McLaren subsidiary. Karmanos Cancer Institute embodies that philosophy through its long-standing commitment to help patients gain access to emerging treatment options. Karmanos offers one of the most robust clinical trials programs in Michigan, with a well-stocked biobank to advance personalized medicine and improve patient outcomes. In fact, some of these newly developed drugs cannot be obtained at any other cancer program in the state. Patients enrolled in trials receive new, emerging treatment that is studied and designed to be better than current therapy. The goal at Karmanos is to offer every patient the opportunity to enter a clinical trial. You cannot have a growing and successful health system without patients, and you can't have patients without physicians to deliver care and treatment. Aligning with physicians through a variety of models has been a key strategy of McLaren Healthcare in 2016. To that end, McLaren Medical Group has orchestrated tremendous growth in the ranks of employed physicians, adding 160 doctors through new employment or by transitioning practices. At the end of 2016, MMG employed 450 physicians representing 33 specialties and anticipates adding another 100 over the coming year. In all cases, MMG works in strategic partnership with the hospital in each region to address recruiting needs and support service line growth. To increase physician engagement, MMG has formed 16 new member committees. With the value-driven business model for healthcare here to stay, physicians are seeking viable solutions to cope with a new world of shifting payment standards, new rules, and tougher quality demands. That's where McLaren Physician Partners steps in. MPP is the integrated network of over 1,500 employed and independent physicians aligned with McLaren Healthcare. In 2016, this population health approach has resulted in the launch of a McLaren Accountable Care Organization. An ACO is a distinct legal entity that teams physicians, hospitals, and other care providers to provide coordinated care for Medicare patients. The ACO commits to a broader definition of care, extending from prevention to acute care to rehabilitation and follow-up. McLaren's ACO will initially include 900 physicians working in tandem with McLaren hospitals to form a high-performance healthcare delivery network. McLaren Home Care Group also represents an important component in McLaren's ability to improve patient outcomes, lower costs, and enhance reimbursement. Keeping patients healthy outside of the hospital setting while coordinating medical and social support has been the traditional goal for the home care group. Succeeding in population health will rely on having a skilled home care team that understands the needs of medically complex patients and manages clinical outcomes in the patient's home after discharge. McLaren Home Care Group tailors specialty care programs around the patients needing stroke care, chronic disease management, rehabilitation from hip and knee surgery, and more. Another big win for McLaren has been the consolidation of laboratory services across the system at McLaren Corporate Laboratory. With more than 4 million procedures conducted annually, the benefits of consolidation have been significant, primarily in reducing variability and increasing quality of tests, while decreasing redundancies and cost. In addition, because of the scale, the lab has been able to insource expensive esoteric tests, which traditionally were sent to large, costly reference laboratories. A key acquisition in the new technology this past year is a Bioplex 2200 system, which automates autoimmune testing and significantly reduces turnaround time for reporting results. It is not only within McLaren healthcare facilities that service excels. A commitment to community benefit is also a hallmark of McLaren. To increase member participation in preventive screenings, McLaren Health Plan mixed creativity with service in implementing its unique Food for You program. The health plan partnered with Greater Lansing and Eastern Michigan food banks to provide food bundles to more than 200 women upon completion of a mammogram. Health plan staff were on site to deliver food and engage members in health risk assessments, satisfaction surveys, and other preventive outreach. The health plan realized an 8% increase in screening rates and won a Pinnacle Award for innovation in improving access to health care. Serving community needs was also the motivation behind a $1.5 million gift from McLaren Greater Lansing to Michigan State University to establish the College of Nursing's first endowed chair position. With mental health identified as one of the Lansing community's top priorities, this gift will specifically fund program development for behavioral mental health nursing education. Through this program, MSU and McLaren Greater Lansing will work in partnership to improve access to mental health care by providing additional educational support and resources to train behavioral health nurse practitioners. Whether providing community benefit, delivering world-class care, increasing access to providers, or investing in leading-edge technology, McLaren Healthcare is constantly seeking ways to make our best even better. We salute all of those who are part of the McLaren team and who share this commitment.
I am McLaren, and I am compassionate.
I am McLaren. I am quality.
I am understanding.
I am strongly committed to quality care.
I am quality patient service.
And I am great customer service.
And I am a member advocate.
I'm hope.
Exceptional stroke care. And I'm patient care.
Excellent care.
I'm a steady heartbeat.
I am McLaren, and I am care beyond care.